Have you ever wondered why addiction is so prevalent in our society? From the subtle habits we form to the significant dependencies we foster, addiction is a phenomenon that's more widespread than we often realize. It's not merely confined to substances like alcohol, drugs, or nicotine. This invisible enemy takes many forms, including seemingly harmless behaviors such as shopping, eating, gaming, and even social media scrolling. Yet, it's vital to clear a common misconception. Addiction is not a moral failing. It's not a lack of willpower or a sign of weakness. Instead, it's a response, a reaction to pain, a desperate attempt to seek solace in a world that often seems overwhelming. It's your brain trying to self-medicate, to treat the wounds with dopamine, the feel-good hormone. So, it's crucial to understand that addiction is not a choice but a desperate attempt to escape discomfort and pain. So, what's really happening in the brain of someone grappling with addiction? Well, to understand addiction, we first need to talk about dopamine. Dopamine is a chemical messenger in your brain, playing a critical role in how we experience pleasure. It's like a little reward your brain gives you when you do something it likes. Perhaps when you eat your favorite dessert, share a laugh with a friend, or even when you complete a tough workout. This dopamine boost creates a sense of satisfaction, a feeling of reward. Now imagine if you could trigger this dopamine rush on demand. That's precisely what addictive substances and behaviors do. They have the power to artificially stimulate your dopamine system, often far more intensely than natural rewards. This surge of dopamine creates a powerful sense of pleasure, a high that can make you crave more. But here's the catch. The brain is a clever organ. When it's regularly flooded with dopamine from an external source, it tries to restore balance. It starts producing less dopamine on its own, or reducing the number of receptors that can receive dopamine signals. So, over time, the brain becomes less responsive to the substance or behavior, and even to natural rewards. This is why individuals grappling with addiction often need more of the substance or behavior to achieve the same high, and why things they used to enjoy may no longer give them pleasure. This is where addiction gets its grip. The brain's wiring has changed. The substance or behavior that was once just a source of pleasure becomes a necessity. Without it, the person may feel flat, lifeless, unable to experience joy. Quitting can lead to withdrawal symptoms, making it difficult to stop without help. In essence, addiction is like a hijacked reward system in the brain, where the substance or behavior becomes the priority, often at the expense of everything else. It's not just about willpower, or morality, or strength of character. It's about understanding how our brains respond to these powerful influences, and how we can better support those in the grip of addiction. But what does childhood trauma have to do with all of this, you might ask? Well, it plays a significant role. Childhood trauma, whether it's physical, emotional, or environmental, can create a deep-seated sense of fear and insecurity. This lingering unease can lead to a desperate search for relief. In an attempt to escape these feelings, many turn to addictive substances or behaviors. It's like a misguided self-medication. The instant gratification they provide can momentarily mask the pain, creating a dangerous cycle. The relief is fleeting, and the individual is drawn back time and again, seeking that temporary solace. Addiction, then, is not so much a disease of substance abuse, but rather a maladaptive response to unresolved trauma. It's the brain's way of trying to heal, albeit in a harmful and self-destructive manner. So, it turns out, the roots of addiction often lie in the painful experiences of our past. Now let's tie all of this together. Addiction, a puzzling enigma for many, is prevalent in our society, and most of us, in one way or another, are addicted to something. The science behind addiction is complex, but at its core, it's about our brain trying to treat trauma with dopamine, a powerful neurotransmitter that gives us a sense of pleasure and reward. The link between childhood trauma and addiction is particularly potent, with traumatic experiences in early life often leading to addictive behaviors later on. It's crucial to understand addiction not as a moral failing or a choice, but as a response to pain. It's a cry for help, a desperate attempt to cope with overwhelming emotions and experiences. Remember, compassion is the key in dealing with addiction. If you found this information helpful, please click like and subscribe for more insights like these.